25-year-old fashion and design student Linda Acheng lives with sickle cell disease. Behind her warm smile lies constant pain, a reality shared by thousands.
So, kama ku access medication, imekuwa very difficult.
Despite her dream to design beautiful garments, her own life thread unravels one frail strand at a time. She's one of the estimated 14,000 children born with sickle cell disease in Kenya.
A relative died because lack of medication, like walikuwa hawawezi na kukuja naambiwa ati hawakuwa wanaweza access medication, so it led to death.
Blood transfusion services, vital for trauma care and chronic conditions like sickle cell, are under immense pressure. This year, the sector faces a staggering 3 billion shilling shortfall. The government has allocated a paltry 300 million shillings for equipment at the National Blood Transfusion Services in the financial year 2025-2026 budget.
And one of the plights at times for critical patients is just the need for blood. And so, as you've rightfully asked, is that one of the challenges and reality that we need to look at is the donor financing has been reducing. And so as a country, we need to ask ourselves, how do we increase our domestic resources, both in the national budgets, but also county budgets, and also ask ourselves, who else can we engage for financing? Like, for example, the private sector. We can have
people living with sickle cell disease like Linda rely on regular and timely transfusions. With budgets slashed, their lives hang in the balance.
Yeah, like unaweza enda OC, uambiwe kuna hii na hii inahitajika na itakuwa covered under SHA. Yeah.
Zooming out for the broader picture, Kenya's health budget has grown significantly. The financial year 2025-2026 allocation now stands at 204 billion Kenya shillings, up from 118 billion the previous year. This is driven largely by the push towards universal health coverage. Critical components remain drastically underfunded. The primary healthcare fund, projected to need 61 billion Kenya shillings, received only 13 billion, leaving a whopping 48 billion deficit. The emergency, chronic and critical illness fund was allocated just 10 billion against a required 107 billion, a 97 billion gap.
The well-being and wellness. So really, yes, we need to have more investment in primary healthcare, but at the same time, we can also have innovations, especially because we know that county governments allocate budgets towards health, but also the national government is having the primary healthcare fund. So we need to see how do we work with the two to ensure that people get services, but also have conversations and ask ourselves at every community level, what are the health needs that people have? And look.
Kenya's HIV response, long supported by the international donors, is now facing serious disruption. Key programs funded by PEPFAR and USAID have been affected by a freeze in US foreign assistance.
We've asked the Ministry of Health to make sure that HIV is treated under SHA. And if you look at the budget, the chronic and chronic illnesses and other sectors have money. So that can be leveraged to help procure ARVs, TB medicines to give out. So that budget is reducing. We are still advocating that Kenya increase their budget.
Another alarming front in the funding crisis is vaccines. Kenya has faced intermittent shortages due to delayed co-financing payments with the Global Vaccine Alliance, Gavi. The Ministry of Health reports a shortfall of 4.27 billion for the procurement of life-saving vaccines and reproductive health supplies.
And I would say some of the ripple effect of now coming to honor the co-financing at the end of the financial year means that whatever that amount of money was to procure has not been in the pipeline during the year. And there's a high possibility that there will be stockouts.
These delays affect Kenya's youngest and most vulnerable citizen, with children missing immunizations and family unable to access contraception or maternal health services.
CS Health na CS Treasury kuhusu madawa za mostly sicklers ni ngumu kupata. Hiyo tu ndo naomba kabisa watusaidie hapo tu. Alafu na hiyo SHA ikuwe like easy to access medication, whether outpatient ama inpatient.
From sickle cell warriors to HIV patients and newborn in need of vaccines, Kenya's most fragile populations are staring down a dangerous future. Despite a growing budget and government pledges to explore alternative funding, the gap between health needs and available resources remains dangerously wide. Eunice Omollo, K24 TV.